Hey there, Middle Tennessee. I am Daniel Adams. I'm here with Dr. Kent Lofley of Blue Ocean Family Medicine. How are you, Dr. Lofley?
Doing well. Good to see you, Daniel.
Good to see you too. Hey, I'm excited today to talk to young mothers or more seasoned mothers in their 30s and their 40s with growing families. Because here's the problem I keep running into. I have an 11-year-old son, and he's finally getting to the place where he's starting to eat us uh, into a new grocery bracket. Um, but one of my other problems is I feel like so many of our options are limited. And when my child has health issues, it's taken me weeks to get in to anybody to see him unless I take him to urgent care, but I don't want to deal with urgent care and the circus that comes with that. So what I'm curious to explore today is this other alternative that is direct primary care with Blue Ocean Family Medicine. So tell us a little bit about what y'all have been doing for growing families.
Yeah. So access to get in to see a doctor right now, it can be really difficult. Like I was just reading a news article the other day that said it takes about 26 days on average from the time you decide you need an appointment with your doctor until you can get in.
26 days.
It's
Because here's the problem. My son, he doesn't wait until 3 o'clock on Wednesday afternoon to have whatever strep throat thing he has. It's always in the middle of the night. I don't know why. It's always Saturday night that he comes into my room at 3 a.m. and wakes me up puking. Like, I don't
yeah.
have 26 days to go handle this.
Yeah, exactly. So that's the huge problem that we're seeing. So at Blue Ocean Family Medicine, being a direct primary care practice, we limit the number of patients that we have in the practice to 500 to 700 patients. And that in comparison, like a typical family medicine office will have 2,500 to 3,000 patients. And because they have so many patients and the appointments get booked out, it takes so long to get in.
I mean, it's great for their checkbooks, but like my kid isn't getting the care he needs.
Yeah.
And
Yeah.
it's
So
already
by
hard enough to get my husband to go in. That's what I keep hearing. Like, I don't want to
yeah.
go in. Like, I personally don't want to go in for stuff, but my wife keeps hammering me like, hey, you got to go get this taken care of. I was like, well, fine. I don't want to hear it anymore. So I guess I'll go.
Yeah. So because of that, we leave room every day to have appointments for people who are sick. So same day, next day, if you're sick, you can get in and be taken care of. The other thing is like if it's after hours or if it's the middle of the night or in the morning and you have a question, something comes up, you can shoot me a text. I may not respond to it at 2 o'clock in the morning, but you can shoot me a text. And when I get to that text first thing in the morning, I'll text you back and we will do a video visit or figure out how to take care of the problem over the phone, or we'll have you come into the office for a visit to get your sick kid taken care of. So
So
you
we're
don't have to
talking
go
next
into the
day.
urgent care. Oh yeah. Yeah, absolutely.
Well, that sounds awesome. How much does it cost to receive
Yeah.
healthcare from Blue Ocean Family Medicine?
So it's a monthly membership fee. It's $65 per individual. For families, the most we'll charge is $260 a month. So if there are more than 4 people in the family, that price doesn't go up.
And this is so I could text the doctor whenever, day or night. Next day, I'm getting service. And it's all done right there in the office.
Yeah, absolutely. So you can come into the office and get the strep test done or do a test for a UTI, or we can take care of an ear infection. And sometimes you don't even have to come into the office. We can take care of it through a video visit and those type of things and save you a trip even to the office.
My kid's at a wrestling tournament and throws out his neck. Like, I don't have to wait 6 weeks to get into a chiropractor.
No, if you have some concerns, you can, reach out. We can see what's going on, get them into the office if we need to do some type of adjustment or help stretch out the muscles or, figure out what's going on so we can get them feeling better as soon as possible.
Well, that sounds like a ton of value. Now, for me, I know balancing all the activities in a family can be busy. How do you help families get their medical care taken care of, like around all the busyness?
Yeah. So through the other type of options of reaching out to the practice, right? So if there's concerns that come up for them being sick, that's where texting comes in, or doing video visits, right? And we can get them in same day, next day when they're sick, and then also get them in to get all of the other wellness exams taken care of, sports physicals, all of that. So we do have regular office hours where you can get in and get all that taken care of. But if we need to make some adjustments to be able to get people taken care of, there's some flexibility in scheduling.
Affordable, flexible, that all sounds great. You know, the other thing that's really got me curious is I feel like in the past when I've gone into the doc, you know, when we finally get into the doctor after however many weeks, they say, here's what we should do, but insurance is only going to pay for, you know, one of these 4 options. So I guess you got to do one of these 4 options. Is it any different for y'all?
Great question. So being a direct primary care practice, we don't bill insurance. So because of that, we can discuss alternatives to what the insurance company would typically pay for, and then talk about, I guess, the transparency of what those costs would be. Sometimes if you want to use your insurance to pay for a certain study, even though you're paying the membership fee, they're not going to pay for it or the medication unless, you know, you meet the insurance requirements. But we can still have the conversation about how you could do that other treatment or that other test and pay cash for it, and do it at like an affordable, transparent rate. So I do my best to help patients see what their options are, have a real understanding of how much that's going to cost, and then let them make a decision of what's going to work best for them.
That makes sense. Because I know I felt limited, you know, some company with a bunch of people I've never talked, I couldn't talk to a person if I tried from this insurance company is telling me what kind of care my kid gets. Like, that's completely unacceptable for me, because freedom's so important, right? I want the best possible care, and I want to be able to have an open, honest conversation with the doctor about what's going to be the best option for us without some company telling me what we can and can't afford, you know? Like, I really appreciate that flexibility that comes along with Blue Ocean.
Yeah, and a lot of time in a different type of office, you wouldn't even have that discussion because they know the insurance company is only going to pay for one thing. And if you want to use your insurance to pay for the care, they just say, this is the option.
This is your thing.
This is what you do. Yeah.
Do you think this kind of membership-based practice will stick around?
I do. So it is still a growing trend in the United States, but because of the rising cost of health insurance, the rising cost of healthcare in general, we really have to make changes to be able to streamline the process and make it more affordable for everyone. So direct primary care practices are really going to be around for a long time. It's really kind of going back to the old traditional way of doing family medicine.
This is like where it all started, right?
Doctor, right? Yeah. Like the old country doctor where, you know, if you were sick, you could go in and be seen and, you know, pay with eggs or whatever. You have that personal relationship with the doctor. That's really what direct primary care is. So it's kind of already existed in the past until corporate America got involved with healthcare, and then they created all the bureaucracy around that. And now we're going back to that old model where patients have this direct relationship with a doctor that they know, and they can have these open discussions about what the best treatment is. And this kind of resurgence of this model, it's been going on for the last 10 to 12 years where there've been doctors who are doing this, and it's just growing. So now there's probably about 1,200 practices in the U.S. That are doing direct primary care.
So there are a bunch of people that are on this train of getting back to having a real personal relationship with the doctor.
Absolutely. Yeah.
Well, this is amazing. So where do folks get a hold of y'all?
Yeah, so you can go onto our website, blueoceanfamilymedicine.com. There's a place there that you can either schedule a question and answer session, and we can do that through a video or phone call, or you can come into the office and get a tour and we can talk face to face. Or if you're ready to sign up, you can schedule your first appointment right online, and we'll get you into the office soon and get you taken care of.
Thank you so much for what you're doing for families, Dr. Lofley. Appreciate it very much. God bless you and be well.
Thank you, Daniel. Thanks for your time today.
You bet.